Good evening. This is The Probe. I am MFA Pao and I welcome you to the show on behalf of the team. Tonight, we are a mark since COVID-19 was recorded in the country in March 2020. Out of this number, 821 have sadly passed on. Our active COVID-19 cases as of July 21 stands at 4,094. Thankfully, 96,255 persons have recovered. Shortly, I'll take you to the Jubilee House for update number 26 on measures taken against spread of COVID-19 in the country. I bet you've been waiting for that. The President Akufo-Addo, will be giving us that address shortly. We're live on JoyNews channel here and also on Joy Prime. We're on DSTV channel 421. GoTV is 144. On radio, it's Ghana Health Service. What is it going to be? I'm sure people have been talking about whether there's going to be some imposition of restrictions already. We know that there's such and a similar way in some schools, SHSs, the final year students are unable to go home as a result. We'll give you more after that update number 26 with President Akufo-Addo. I'll take you live now once we have the all clear. Welcome once again.
Fellow Ghanaians, good evening. I've not come into your homes for some time because I had hoped that the next time I did so, I'll come to announce that we were ready to lift the restrictions and protocols and put our lives and economy back to normal. Alas, that is not the case. So it has become necessary for me to come to your homes this evening after a 10-week absence to provide you with an update on our nation's COVID-19 situation. As per data available from the Ghana Health Service, it appears that unfortunately our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which according to the World Health Organization has increased transmissibility rates and in our case in Ghana has led in recent weeks to a rise in hospitalization and ICU bed uptakes and tragically deaths. Indeed, in update number 25, the last date I rendered on 16th May, our total active case count stood at 1,314, with our daily infection rate standing at 100. 1,121,168 tests had been conducted, of which 92,460. The situation improved significantly, whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. However, in recent weeks, we've seen a marked increase in the number of cases. As of Friday, 23rd July 2021, 3 weeks later, the Ghana Health Service is now reporting that our total number of active cases stands at 4,521. 6,759 persons have recovered. Our daily infection rate for the past week is 350 cases, and sadly, 40 more people have died from COVID-19 over the last 10 weeks, bringing the cumulative number of deaths to 823 deaths since the onset of the pandemic. Greater Accra with many going about their daily duties in clear breach of and disregard for the protocols. At a time when the economy is on the rebound and businesses' activities picking up, we must do everything possible to contain this outbreak. We cannot afford to return to the days of partial lockdowns, which brought considerable hardships and difficulties for all of us. You returned me to office in the elections of 7th December with a clear and decisive mandate to protect lives and livelihoods. Protocols which we have implemented since March of 2020. They've stood us in good stead, and we have no choice but to return to the strict implementation of some of them. It is extremely troubling to note that the high compliance rate with mask wearing has fallen alarmingly. The wearing of masks in public places, fellow Ghanaians, continues to be mandatory. There are no exceptions to this rule. The Covid-19 task force, which I chair, has recommended that a second look be taken at the protocols that have been put in place for social and public gatherings, in particular weddings and funerals across the country. I have in previous updates emphasized the need for the strict observance of safety protocols at all such gatherings. To ensure that such gatherings do not become the sources of infections, the following must be adhered to by all at these gatherings. Events is limited to 2 hours. Fourthly, there must be observance of the 1 meter social distancing rule. And fifthly, handshakes must be avoided. Furthermore, given that people sitting together to eat, drink, laugh, dance, and talk in large gatherings without masks are the riskiest activities for spreading the virus, all post-event receptions, particularly related to weddings and funerals, are banned. It is important that owners and management of businesses and workplaces implement strictly the guidelines on staff management and workplace protocols, such as the use of a shift system and technology, mask wearing, social distancing and hygiene protocols, as was required in the earlier days of the pandemic. Mask wearing in commercial vehicles and in marketplaces continue to be mandatory. The Ghana Health Service has moved to fortify its contact tracing, testing, and treating campaigns, especially across the hotspots of Greater Accra and Greater Kumasi metropolitan areas. We continue to ensure that all arriving passengers at the Kotoka International Airport are in possession of a negative PCR test result upon their arrival in Ghana, a test which should have been conducted not more than 72 hours before the scheduled departure from the country of origin. In addition, all passengers will continue to be subjected to a mandatory COVID test on arrival. Fellow Ghanaians, indications are that in the course of this quarter of the year, the availability of vaccines for our country will ramp up. Government is therefore standing by its commitment to vaccines by countries and the surge in infections the world over. So far, 1,272,393 vaccine doses have been administered, with 865,422 persons having received a single jab, and 405,971 persons have received their full dose of 2 jabs. We're expecting through the COVAX facility and the African Union 1,229,670 doses of the Pfizer vaccines from the government of the United States of America and 249,000 AstraZeneca vaccines from the government medium supply platform in this quarter. We have, as such, upgraded our national, regional, and district cold chain facilities in order to widen our access to vaccines like Pfizer and Moderna that require minus 70 degrees Celsius cold chains. These include 16 ultra-low cold freezers, 58 units of ultra-low freezers, 50 normal vaccine refrigerators, 300 boxes to be filled with ice packs, 300 ice-packed freezers. I thank as well UPS, the American multinational shipping, receiving, and supply chain management company, and Cosmos Energy, the American oil and gas company, for their generous donations towards this development. Fellow Ghanaians, it is important to stress, once again, that all the vaccines to be used in the country have been certified as safe for use by our national regulatory agency, the Food and Drugs Authority. There should therefore be no hesitancy. Means that we must develop our capacity to produce our own vaccines domestically and reduce our dependence on foreign supplies. We must be self-sufficient in this regard in the future and prepare ourselves better to deal with any such occurrences in the future. To this end, the committee I established under the leadership of the world-renowned Ghanaian scientist, Professor Kwabena Frimpong Boateng, to the National Vaccine Institute to spearhead this development. Government is committed to inject seed funding of some 25 million United States dollars this year into this whole enterprise. The Institute will be charged with delivering 6 clear mandates. 1, establishing local vaccine manufacturing plants. 2, deepening research and development for vaccines in Ghana. 3, upgrading and strengthening the FDA. 4, forging bilateral and multilateral partnerships for vaccine manufacturing in various areas, such as funding, clinical trials, technology transfer, licensing, and assignment of intellectual property rights. 5, building the human resource base for vaccine discovery, development, and manufacture. And 6, establishing a permanent national secretariat to coordinate vaccine development and manufacture. In the short term, the Frimpong Boateng Committee is facilitating the capacity of domestic pharmaceutical companies to fill and finish COVID-19 vaccines. Enuanom, na ochi miense ntemnie, yare no asane ama ne ho so biom. Enam se ye ndi hihyae ne so. Titru ye jai mask no hye. Mesramo. Ihyehyɛ ayaye efa mask no no. Mundi so. Se ufifia hye mask no. Eno ene bebo ye ho ban. Na me yetumi apam yare efiri yemem. Anyame me. Otie tene. Ila isa ewuhe no ekun. Ejake wo ye hela agbeji anoto. Titru mas wo mi panyefai. Gbeji anoto la ke fosi ye mas wo nye yano. Ko sisia wo maske no ni ba buohi ni ba wawo no wo hwe hela keje wo manemi. Fellow Ghanaians, we must remember that the virus continues to jeopardize our lives and livelihoods. Without doubt, God has been gracious to us. I appreciate that the wearing of masks is difficult for all of us, but I entreat you to wear the mask. This is what will save us. I ask this evening that we remain steadfast in our adherence to the protocols so we can overcome this third wave of infections. If we do so, we will soon be able to return to our normal way of life. 0 active cases must remain the overarching goal, and I have no doubt that together and with the help of God, this too shall pass, for the battle is still the Lord's. May God bless us all and our homeland Ghana and make her great and strong. I thank you for your attention and good night.
That's update number 26 just gone by from President Akufo-Addo at the Jubilee House. So we've been getting updates on measures put in place to curb the surge in COVID-19 in the country. Delta variant has hit us. It's official. We are in the third wave. Amongst others, active cases now stands at 4,521. That's where we are. Over 5 million testing have been done. 96,758 recoveries. That's an update on what we had previously on the Ghana Health Service dashboard. So our daily infection rate is now at 350 cases, and we have 40 more deaths and 823 deaths. That's where we are since we recorded COVID-19 in the country. Mask wearing, we are told, remains mandatory. Post-funeral and wedding receptions have been banned by the president. And also in workplaces, we are encouraged to use shift systems. And we've also had updates on our vaccination. We're told that we are still on course to vaccinating 20 million adults, Ghanaians, in this country by the end of 2021. Our quest for herd immunity, we are told, we're still underway. Also, tonight, there are some updates on contact tracing, testing, and treatment by the Ghana Health Service. Of course, we have the Director General, Dr. Patrick Aboagye, joining us tonight. We'll get updates on that. We also had updates on that committee that was put in place. It was announced some time back when the president addressed the nation. Professor Frimpong Boateng committee, they were supposed to look at ways we are going to get vaccines in the country. 6-pointer preliminary report that they've put together, amongst others, a seed of 25 million will be put into that. We'll get details of that also. And in the short term, a domestic pharmaceutical system have been put in place to ensure that those pharmaceutical companies are able to give us what we need in terms of vaccines. There was also updates on the vaccines that we are acquiring, the Pfizer, Moderna, Johnson & Johnson, amongst others. We'll get all that details right here on the probe tonight. You know that's your source when it comes to everything you need to know about COVID-19 in this country and our fight to beating this third wave. I'll bring in now the Director General of the Ghana Health Service, Dr. Patrick Aboagye. Thank you very much for your time here tonight on the probe. I hope all is well with you. You're safe, aren't you?
We are all safe, and I think we have to take our destiny into our own hands and protect ourselves, and so protect others. Yes, we are safe.
Okay, destiny in our own hands.
We cannot.
When you say we take our destiny in our own hands, you mean that in terms of safety protocols, and not that everything is in our hands at this point?
That's what I'm. Yeah.
Okay.
In terms of safety protocol, which is the most important aspect, preventive aspects. The health sector will do its own, but the individual must wear the mask, must avoid the social gatherings, and ensure that they don't get infected in that way. And by doing that, they are not able to infect others. And then so it has a beneficial effect. We've done it before.
Okay.
We've been able to bring down the wave without vaccines, and so we can do it again.
So, but we've done it before, but there were warning signs, writings on the wall. We had scientists continue to raise awareness about it, that the third wave is imminent. What really did we do about it? Did we just sit and wait for it to hit us?
No, thank you. I think this is how these pandemics move. And so we've had the first one, the second wave. We were anticipating a third wave, and so there was a lot of work done to that. But of course, it could have been averted if we had the vaccines. And so those were the approaches we're looking at. And I mean, if you don't have enough vaccines and you don't obey the protocols, we will move into that, especially when our neighbors, other countries get infected. It's only a matter of time that it reaches. So yes, nobody thought that we were just safe, but that's why we kept talking about that. We've had a very good window to improve our systems and also improve our protocols and also get vaccinated. Then we can also be able to avert the next wave if it comes, or be able to minimize its impact significantly.
Okay, we'll get into the first batch of questions shortly, but we're hoping to hear an update from the President's address on the situation in our schools, for instance. But that did not happen, but thankfully you're here with us. What's really the situation? The last time we had updates about some schools being infected, we're getting cases in our schools and all. Are our schools safe as it is?
Yeah, thank you very much. I think schools are safer than those of us outside schools. And I say so because we mentioned that outbreaks in schools. When there's an outbreak in a school, one school can get a lot of numbers. For example, we got over 200 cases positive in Achimota alone. There were 4 other schools in Ashanti region that also provided additional number of, between them, nearly 200 cases. And still, we're still monitoring and responding to that. But that is, even if you just limit yourself to secondary schools alone, that is about 5 out of 800 schools across the country. And so certainly, the majority of schools are safe.
And these schools, you mean SHS?
If the schools follow the protocols, they will be safe. And I think majority of the schools are following the protocols.
So these schools you talk about, this is at the SHS level, or all schools you mean?
These are SHS levels. And I think we had one university that, by the number that we are talking about, one will not say it's a major outbreak, looking at their numbers. But there were a few cases in that university. And so that still makes those environments relatively very safe, as long as there's no undue mixing from the general community.
Okay, so just so we're clear, we've been hit by the third wave. It's no longer imminent, it's no longer potential. Just the clarity that we need to start it off, then we can get into the questions.
Yes, I think we can say that for planning purposes, for tactical reasons, it is very clear that we are in a third wave.
Okay, well, let's get into the first batch of questions. We'll get into the others as we go along the line. We'll start off from Facebook, and this one from Fred says, what's fueling the current surge? When are we taking delivery of vaccines? Does he think it's time to tighten restrictions now that the third wave is here? That's Fred's question. Ransford says, how is leadership intending to win back public trust, seeing we are not walking the talk? Ernest Obing says, I have taken the first dose of vaccination. I was informed the second dose will be available 2 months after. I have visited the health center a couple of times, and all they say is to go and come another time. Please, I'm getting worried. That's Ernest. Barbie says, are we on course to achieving our 20 million vaccine target by end of year? Well, the president has been speaking to that, Barbie. So I'm sure we can get answers for the first batch of questions. Okay, Labi says, our intensive care units are getting full. Are there any plans for alternatives? Labi is asking. And then we've taken this from Fred already. What's fueling the current surge? So maybe we'll start off from there. So you've seen a number of questions that have come up. So maybe we'll start off from Fred's question. What you think could be fueling this surge, apart from the protocols and all, amongst others? I'm sure we can get answers to that.
Yeah, thank you very much, Emefa. The current surge is fueled primarily by, of course, mainly by non-adherence of protocols. Secondly, is the fact that our neighboring countries around us, and I mean globally, there's an increase in the number of cases, even in countries with very high levels of vaccination is coming up. There's also the entry of the Delta, which is a very, very fast-spreading variant, also into the world and also into the Ghana. When Ghana recorded this first Delta, about 98 countries had also recorded a Delta variant in their country. And so these are the 3 core reasons. And of course, the fact that our vaccine coverage is very low. These are the 4 reasons why we are in the situation that we are in. But these are areas that we continue to fight.
But just so we're clear, the active cases that we have currently, Dr. Aboagye, before you go on, the active cases that we have, the 4,521 active cases, are they all Delta? Do we know?
No. Currently, what we have, the Alpha, which is the UK strain, is still the leading variant. What we have seen is that increasingly the portion that is belonging to the Delta continues to increase. And so, but because we do something, I cannot tell you that of the 4,500 active cases, the proportion is Delta, and this proportion is Alpha or the other variants. There are many other variants, and so those are the way it is. So that's where it is. But Alpha is still the lead, but we can be sure that if things don't go well, Delta may overtake us, quickly spreading and also increasing its hold.
Okay, so he's been asking, I think Babi is also asking when we are taking delivery of vaccines. The president had been touching on that, but we didn't get the exact timelines. And Fred still wants to find out if you think it is time to tighten restrictions now that the third wave is here.
Well, I think the restrictions need to be tightened. I'm sure you heard the president about how we need to also abide by them in tight restrictions. And all of us have to be a bit helpful in applying these protocols. Yes, the vaccines, it's always now become very difficult to give dates, but we have indications that for the vaccine, like the president said, we are going to get, latest by middle of August, we should get some AstraZeneca to continue giving the second doses. And for those who have had their first dose, yes, supposed to be 12 weeks after, most of them are beyond that, but we also know that they are still better protected than those who do not have vaccine at all. We are also expecting the next, same August, about nearly 1.2, 1.3 million doses of Pfizer, whilst other efforts continue to take hold. Then, our engagement with the African Medicine Platform, we have made a deposit for about 17 million doses of the Johnson & Johnson. And when all these things come, we should be able to vaccinate. Ghana has a the EPI program of the Ghana Health Service has a very efficient delivery system. Even when we are dealing with just about 43 districts, we can do more than 200,000 to 300,000 doses in a week. And so if we do nationwide, we can do more. And so if we have the vaccines today, we can achieve the 20 million and more, even beyond what, within a short time. So the targets still remain, of course, with the hope that the vaccines will be delivered, the vaccines will be made available for all the whole world to be able to access.
Per chance, is it that we still have some vaccines in the system that people can walk into facilities and still get it? Because recently we've been told that census officials are being vaccinated with some Sputnik, jabs and all. So what is it? What really is the situation? Because we are wondering how census officials got Sputnik and they are being vaccinated. What really is the story there?
Well, I think we already knew that we were going to have census. And we knew that these are people who are going to go from house to house. And so the exposure level and the risk levels are high. So we had reserved the Sputnik for them. Currently, all our vaccines would have expired, except for those who are going to take the final dose of their Sputnik, for those who got the first dose of Sputnik.
How was it stored such that the shelf life issue is of concern? Because from what we heard, this Sputnik came in some time back, and how come it's still safe and potent for use for census officials?
It has an expiry date, and it's not yet expired. And we are going to deliver it before it expires. They have a different expiry date, and it's not expired. And there are plans to deliver. Those who have done their 3 weeks now, and we'll be able to give it to them before the end, the time it expires. So we are still in good time.
Okay. What's the situation with our ICUs? Labi thinks that they are getting full. Are there any plans for alternatives?
And I said, and as long as it's not able to contain, you're going to have more people, a proportion getting sick, and as the numbers increase, the number also increases. So currently, we have a challenge, even though our functional ICU is about 45 or so. We still have a challenge in terms of the numbers available at each particular time. There are efforts to ensure that additional ones are created, but that is not the solution. And that is why even the biggest of countries have had their ICUs overloaded if we don't control the spread of the virus. And so, yes, we'll do our best, but the most important way is not to get to the ICU, but rather to prevent the infection. So we are working on both sides, but our greatest effort is going to ensure that we reduce cat transmission. So we have fewer people who will require ICU. You see even greater countries where had their ICU beds choked if you can't have a control about it. And so it's not a question of creating more ICUs, because if you do that and you don't control the spread, you're still going to get them filled up. So that's the balance we're trying to keep. And that balance depends on just only the health sector and the leadership, but also the people of Ghana to ensure that we all protect ourselves from going down that lane.
And this is a situation you would say that we have under control. But Ernest is asking the same issue about vaccination. He's been asked to go and come a couple of times. He's getting worried. For such, we always get questions like this. Those who've taken the first jab are yet to get their second. What really is their situation? Because we're told that after a month it's still okay. Now the time keeps extending. Should they keep waiting?
Well, vaccines have the shortest interval within which the second dose we take. We are waiting for a booster dose. Yeah, we wish we had it at the 12 weeks, which we had promised. But unfortunately, there's a global shortage of vaccines, and you all appreciate the challenges not only Ghana but other countries are facing. But I also say that we also have about 19 million plus, or people eligible people who are still waiting for their vaccination. And we believe that for those who have had one, they still have a relatively higher protection than those who don't have. It's unfortunate, but there's every effort is being made. Like I mentioned, that we're going to get AstraZeneca within the next few weeks, and then that group will be targeted. We know where they are, and they'll be vaccinated.
Okay. Well, you heard the Director General. Well, the President has been updating us on what you've been doing in terms of our 3 T's, I would say, tracing, testing, and treatment. We'll get into it, plus some complaints we are getting from M Plaza, for instance, amongst others. We'll take answers to that and more right after this break. Dr. Patrick Aboagye is my guest. This is The Probe here on the JoyNews channel, also on Joy 99.7 FM. We're live on Joy Prime. DSTV channel is 421. GoTV is 144. We're on myjoyonline.com, all our social media platforms, a dozen affiliates across the country, and Love 99.5 FM in Kumasi. We've got you covered everywhere, and your questions are coming in thick and fast. I can see a number of them coming live. You sent some earlier also. We've been taking the President's address update number 26. We've been giving what has been done in terms of measures put in place to curb the spread of COVID-19. Delta variant is with us, and we're told it's official. We are in a 3rd wave of COVID-19. It's your responsibility as well as mine to stay safe and to protect each other. Dr. Patrick Aboagye is my guest, Director General of the Ghana Health Service, and we've been taking some answers to some of the questions that you posed earlier. We'll get into the next part shortly. But before the break, I was telling you, Doc, about the President's updates on what the Ghana Health Service specifically is doing in terms of contact tracing, testing, and treatment. We would want some clarity on that, expatiate a bit on what you've done so far, because people have said that we are not testing as much as we ought to. What really is the status when it comes to the 3 T's, like I put them?
Yeah, thank you very much, MFA. I think I've been explaining over the weeks that we have a testing policy. The testing policy is that currently, we are doing those with symptoms and they are exposed people. Once you are positive, you follow up your contacts and test them, which is still an enhanced form of testing, because others will just watch you until you start showing signs. And that is why whenever there are cases going up, you see more tests take place. So you can see from the figure that we are doing more tests, say, this week than we did last week, because we are doing that. On the average, our statistics show that we have on the average about 11 contacts per positive case. And so that is what will determine what we do. But of course, you can have one patient with 200 contacts. and we follow them up. And so that is exactly what we do. And that's why if you look at the Achimota, for the first 3 cases that we had, we ended up testing nearly 1,000 people.
Okay.
And that's how the system is. And so once the cases go up, you see that we're doing more tests because we are doing more contact tracing, we are doing more follow-ups, we're doing more isolation, and that's what is happening. Ashanti region has had to go back to take one of the isolation centers that have been given back to the private owner when the thing, so that now that you have a place to be able to isolate people should the need arise. And the same is happening here. So that's exactly what is going on. We're doing the testing, we're doing isolation, and of course, the expanded contact tracing.
Okay. Is this still free? Testing, treatment, still free?
Yes, the policy has not changed. If you walk in, you may pay. If you are a contact from the hospital, you are sick, you are a contact from as part of a positive case through the contact tracing, that is the public health response. That is free, and nobody's been taking any money from anybody.
Okay.
If anybody takes any money from you, that's an illegal money. I'm telling you, let us know and we'll deal with whoever does it.
Okay, good.
But of course, if you walk to a private facility, you will pay. That will not be free.
Okay. Well,
so let's make sure the system works. That when Joy FM has a case, you don't go to Noguchi by yourself. You tell the Osuprote or the Adabaka, your districts, and then the DHMT will quickly come do an assessment and do a contact tracing, not just in the facility, but in the homes of where the contacts have come from.
Okay.
Then we can have a hand on it.
Hopefully, we won't need that. But there's a video.
I'm just saying if. I didn't say you will.
I know.
I said if.
I'm just hoping that we don't. Well, so there's a video making the rounds all weekend. I'm sure prior to the weekend also, persons, at least I've seen one from a lady supposed to be on a foreign passport and tested positive, being quarantined. But she says that prior to arrival, she had tested negative, the 72-hour period and all, and that she suspects that there could be some connivance of a sort to ensure that people make money out of the system. What really is this? Has this been brought to your attention? What does the Ghana Health Service have to say about this?
Yeah, thank you very much. Yes, I've seen it. Yesterday, I was at M Plaza. I interacted with those who have tested positive in the hotel. Yes, I even met the lady whose video is in. First, I want to make some clarification. There's this erroneous impression that the more the positives you have, some country somewhere gives you money. That is not true.
Okay.
Nobody is giving anybody any money because your cases are high. So that is not true. So nobody has interest in ramping up numbers to go and collect money. I don't know which country is giving that money. Number two, there's also the impression that people behave that way because they don't believe or they are disputing the test results. And I will appreciate that if I'm traveling to come for holiday or visit my family and then surprisingly I test positive, obviously you'll not be happy, you'll be apprehensive, and I appreciate some of the challenges. But to go towards insults, etc., is another thing. There are protocols, and every country has its protocol. The protocol is that when you test positive, you will be detained, and you are told before you fly in here, and that you will have a repeat test on the 3rd day. If you are negative, you are discharged. If you are still positive, you will be kept until you are at day 7, where you will be released, where we are comfortable that even if you are still positive, you are not able to share and also infect other people. So that's the policy. And I'm sure you are aware of other policies. There are other countries, and I think people must respect the fact that for UK, for example, Ghana is amber because of the work we've done here. If Ghana was a red country, if you go back, you go straight to a hotel at your cost. But because of our status, you go back to your home. But even then, you do 2 tests. I don't think you do your own test and send to them. They come and do the test. And you are not going to tell them that I did mine is negative or so I'm going to dispute whatever results they're giving us. So I think we must respect the system that there are people with integrity who are here to do their work well and ensure that they and other Ghanaians that they left behind are protected. And I think we must make it very clear to all that we don't have any interest in any hotel. We don't have any interest in making anybody positive. It increases my number and it gives me headaches. So I wish nobody gets positive at the airport and we'll all be happy. Thank you very much.
But to the extent that the crux of it for Millie is that to the extent that she tested live, 2 test kits, and they all came out negative. Is it that what she used is different from what we do out here?
Yeah, that is the lateral flow. We don't use it here, and I don't use it for international travel in any country.
Okay.
Okay. And so that is not. But I mean, it's not a question of you doing your test. There has to be a protocol. There has to be some rules of engagement. And I'm sure if this happened in any other country, they're not going to dispute that. I've gone to do my PCR and etc. No, we don't do that. We have, and I'm sure wherever they are also coming from, there are rules there. Some of them are even more stringent than we have here.
Okay, well, let's get into the next part of questions at this point. We go on WhatsApp. Ife says, what is the government's position on the exclusion of AstraZeneca from the EU's digital vaccine pass, which came into effect on July 1st? Ife is asking. Loretta says, I want to know what the symptoms of Delta variants are. I've been coughing for about 2 weeks now, and it's dry cough. I've taken all kinds of cough syrups, but still coughing. But then I feel okay, no fatigue, feverishness, no pain in joints, and no loss of taste and smell. It's just the cough. Loretta wants to know. We're still on WhatsApp. Lovia says, how much has the Ghana government spent on vaccines so far? Have we so far only received vaccines through charity? Is the question. And Kinsley says, as part of the Ghana Health Service measures, they seek to deploy rapid tests at borders. Why the restricted test and not the population en masse? Any update on the clinical trials? Okay, so Ife is asking about government's position on the exclusion of AstraZeneca from the EU's digital vaccine pass, which came into effect on July 1. Are you aware of this? Do we have a position?
Yeah, thank you very much. I think we are aware of that, and I think the global community is looking at that, and I'm sure the AU and all those of us whom we received Covid from, and not just as a Covid from COVAX. I'm sure WHO and other areas are engaging to see how we get that resolved.
Okay, so Lovia is asking how much exactly we've spent on vaccines so far. Have we so far only received vaccines through charity?
Well, I will not be able to say the exact figure, but I know that we made significant deposits for EU once, and of course we still ensuring that once we get the vaccine availability, the government will pay for it. But I know I cannot give you exact figure, but we made deposit for AU to look at that. We also spent money in deploying what we've had so far. So yes, probably we've not spent so much because we still not been able to acquire enough vaccines from the global markets.
So it's not all charity, you would say. At least we are paying for something. Just that you're unable to give us the amount in terms of what we're paying.
Yes.
Okay. Well, so earlier I had a question also from Ransford, is asking how leadership is intending to win back public trust, seeing we are not walking the talk.
I don't know what that walking the talk means. Yes. I believe that we are all in the same boat. We are all at risk. And I believe that everybody, including the leadership, and that's why the president is also making the talks, the speech that has been made today. We should, and I think the people of Ghana should trust that. We mean well, the service and others mean well in ensuring that we all maintain utmost protocol. And I think it's up to the people to see what they will do. Basically, we are all here to ensure that we are all feel safe. If I'm not safe, you are not safe. And so I believe that everybody must see to it that it is all for all of us. We all have to protect each other and make sure that we able to bring this virus under control.
But from where you sit as a scientist, Dr. Patrick Aboagye, do you think that policymakers have made it easy for you to educate the public in terms of adherence to protocols when they have flouted it openly?
Well, nobody has ever said behavior change is easy. Behavior change has never been easy. That's why we are doing so much this communication. And I'm sure, Mefa, you know what it means. I'm sure people are talking about funerals. And I'm sure, Mefa, you've also gone to funerals.
I haven't. I haven't.
Because
it's supposed to be banned. It's supposed to be banned in the first place. Funerals are supposed to be banned. I haven't heard that we can now do it. But I'm hearing the president today say post, receptions and all. How come? Is there a change to the EI?
Thing that we have all seen is that funeral is such a deep-seated cultural practice that we cannot just wish it away. But we are now going to make sure we have protocols and guidelines that makes it safe. So allows people not to be seen to be flaunting it and doing it in a way. But it also be more good protocol that will come out very soon. That will help all of us to have these things in safety. Changing behavior is not an easy thing. And that's why I'm sure you've seen other countries deliberately break the rule. They even go on demonstration because they are tired of wearing masks, etc. It's not an easy thing, but we all have to come together that it's for the good of all of us. And so we need to work on it. Well, so I'm sure the question is all about the funerals. And that is why we and the presidency is looking at a situation where we are coming up with protocols that makes it safe and still to have your funerals in safety.
But it's interesting that the third wave is here and already it looks like essentially protocols have been eased instead of being tightened. Is that the advice you're supposed to be giving?
I don't think so. I don't think this is an easing of restriction. This is the same restriction. These are the same rules for mass gathering.
If it's
the same rule for mass social distancing of 1 meter, wearing your mask, ensuring there's ventilation, among other things. So it's rather a rehashing of this protection that we needed to do. Whatever it is, whether it's a funeral or a church or whatever, it's a mass gathering. And these are the basic rules that has to apply. And if it applies, of course, it's as safe as the church or the mosque or any place, as long as this basic hand washing is adhered to, social distancing, and then most importantly, wearing your mask appropriately.
Okay, let's talk about Loretta's symptoms. She's asking if this is a symptom for the Delta variant. I'm sure all of us would want to know. I have a bad headache as I sit, but she's been coughing for 2 weeks now and it's dry. She's taking everything, but she's wondering, tell us, is this the symptom for the Delta variant?
I mean, you can have COVID, doesn't matter whether it is Alpha variant or Delta, the symptoms are the same. The severity may vary, but basically the symptoms are the same. And the severity may vary from person to person based on your whether you have a comorbidity, your age, among other things, and maybe the viral load. So those are the things but we don't have special symptoms for Delta. What we know is that it spreads faster from person to person, unlike the others.
Okay, so you encourage her to take a test if you're getting such symptoms, right?
You should see a doctor.
Okay, all right then. So there's a question from Kingsley also on any updates on the clinical trials, and then also as part of the Ghana Health Service measures, they seek to deploy rapid tests at borders. Why the restricted tests and not population en masse? So we can take from the clinical trials upward.
Well, thank you very much. Yes, there are plans to do clinical trials on some vaccines, and some companies have approached our research centers, and I believe that when they finish, it will be made available. The processes are ongoing to ensure that these trials start, and I'm happy that Ghanaians are now okay for us to do clinical trials, because previously we had all kinds of challenges, but I'm sure if you have been in a country that participates more in clinical trials, we probably have used that to secure some vaccines through the trials. But yes, it's ongoing that And then once it goes on, we continue to provide an update on these trials once they start.
Okay, so there are questions also I'm seeing on those who are planning on holding outdoor events. It's not a funeral, it's not a wedding. And Henry Nekwe has a question to that effect also. He's asking us to tell the Greater Accra Regional Minister to help stop Chaliwati Festival this year. The information run is going around the whole Accra about the Chaliwati Festival. What happens to such events? If it's outdoor, is it okay for it to happen?
Well, I think any mass gathering is risky.
Mm-hmm.
The protocols tend to minimize transmission. So any outdoor event that is not essential, I don't think it should be allowed to go ahead.
Okay. Well, there was a question also about what's the backstory on the detection of the Delta variant in Ghana. How long was it in the system before government announced it? And an interesting one also coming in. This one from Mauli says, I know this is a COVID topic that we're treating, but please, I need you to ask the DG about the health implications of homosexuality, if any.
Thank you very much. Yes, the Delta variant, I think we've given you information already. Since January, we've been doing sequencing, periodic sequencing, and we've been telling you the variant that we have here. When we got the South African variant, we mentioned it. When we got the Brazilian one, when we got the Alpha or the UK's variant, we mentioned it. We made a report in June when we picked up the Delta. The first one was at the airport, but that means that they had not entered. But we picked community numbers in June as it was announced, and especially just before the Achimota outbreak, we made the announcement that we have found the Delta, and that's when we found it. Nobody will know when it's there until we discover it. But based on our sampling, that was the time that we picked up the Delta variant. But the numbers, the proportion was small. Just that the proportion continues to increase to 14% and now approaching some 40% or so. But it's still not the leading variant in the country.
Okay, thank God it's not. Mauli has a question. I'm sure you can give an answer since you're a doctor as well. He's asking if there are any health implications of homosexuality, if any.
Well, I don't know why. I think this is just an ectopic question, but I believe that all sexual activities come with its own risk, STDs, etc., irrespective of whether it's a homosexual contact or male-female issue. So they are all have its own STDs, etc. The same risk exists.
Okay. Thank you, Dr. Patrick Aboagye. In 30 seconds, I'm sure you have your audience all listening why we need to adhere to the protocols once again. I'm sure a word or two before we wrap up.
Yeah, thank you for the opportunity. Yes, the variant is here. We are having a surge, a wave, but the power is in our hands. If we wear our masks, especially if you all decide that let's wear masks for the next few months, I'm sure we can bring it together down. The last time we had about 80% intention to wear, and about 50%, 55% of people were wearing the mask appropriately, and we saw a rapid decline. So I want to use this opportunity to appeal to all that we have a wave. This wave, if it's not contained, will be bigger than the second wave. Okay. And that's what happened in the other parts of the world where they are experiencing their third wave. We all have to come together, wear our masks, and control this. Now, if I want to also add that there's a QR code on the vaccine. We are doing that is for those who are fully vaccinated. They are the ones with the QR code. About 50% of the data is clean, so you get it. We're still trying to clean up the rest of the data so that all of them become active. There are those who are there are active, some are not. What we ask people is that because we don't want, when the names change and at the travel time, we may get some challenge because they may dispute whether it is yours or not. Okay. If you have to travel, please just go to where you had your vaccine, check whether your system is updated properly so that we can update it for you to travel. And then when you do the QR code, you get it done. But give us a few weeks, all the cleaning will be done. and then to be updated. Thank you very much.
Thank you very much, Dr. Patrick Aboagye, Director General of the Ghana Health Service, my guest tonight on The Probe. There's more news when you log on to myjoyonline.com. For our radio audience, A Walk with Jesus is up next. I am MF Fapa on behalf of the entire team. Thank you.